Welcome to our discussion on rising antifungal resistance in Candidosoma auris. We'll explore signals, gaps, and the path forward in addressing this critical issue in clinical infectious diseases.
Candidosoma auris has evolved from an emerging curiosity to a global public health threat. Concerned, it spreads efficiently in healthcare settings due to prolonged skin colonization and environmental persistence. This pathogen resists standard disinfectants and shows multi-drug resistance, often to fluconazole, amphotericin B, and echinocandins, complicating infection control. The DAS et al. Study is a landmark in Candida auris research, offering a decade-long analysis of 596 isolates from 37 Indian healthcare centers. Thoughtful, it integrates phenotypic and molecular analyses, including ERG11 sequencing, providing crucial insights for clinicians, microbiologists, and public health stakeholders. Published in Clinical Infectious Diseases, it highlights evolving antifungal resistance patterns. The rise in resistance to amphotericin B and echinocandins in Candida auris is alarming. Concerned. While fluconazole resistance is well known, these two classes were key alternatives. Amphotericin B resistance threatens last resort options, likely due to ergosterol pathway changes. Worried echinocandin resistance, as shown in DASET and others' data, critically narrows treatment options. The treatment landscape for invasive candidiasis is fragile with limited antifungal classes. Concerned, echinocandins are first-line per global guidelines, while liposomal amphotericin B is a second-line option. Emerging agents like ibrexafungerp and olorofim are promising but not fully validated for Candida auris. Worried rising resistance across all classes threatens effective therapy availability. The study's major limitation is the absence of denominator data, affecting epidemiological interpretation. Thoughtful missing elements include patient numbers, hospital admissions, and screening protocols. Without this data, observed increases in Candida auris isolates may not reflect true incidence, risking misallocation of public health resources. Concerned. Accurate analysis requires both numerator and denominator data under standardized protocols. The study's geographic and institutional representativeness is skewed, with isolates from 37 centers in India showing regional imbalance and private sector predominance. Concerned, this referral-based collection may inflate resistance rates. There's a critical need for structured national surveillance with standardized sampling and data protocols across healthcare sectors to accurately reflect the Candida auris burden. The study utilizes broth microdilution susceptibility testing, adhering to European Committee on Antimicrobial Susceptibility Testing, or Clinical and Laboratory Standards Institute standards, to generate minimum inhibitory concentration data for antifungal agents across 596 isolates. Thoughtful. This robust methodology allows for temporal trend analysis. However, the molecular analysis faces a depth versus breadth challenge, limiting interpretive power due to resource constraints and selective genotyping. The genotyped subset exclusively identified clade 1, the South Asian clade, among all typed isolates. This clade is dominant in India, Pakistan, and Bangladesh, associated with high fluconazole resistance. Surprised. The absence of other clades in this dataset is surprising, highlighting the need for comprehensive genotyping to understand true national epidemiology. The study highlights ERG11 mutations, Y132F and K143R, linked to azole resistance in C. auris. Curious, these mutations alter lanosterol 14 alpha demethylase, reducing azole binding. Intriguingly, these mutations also appear in fluconazole-susceptible isolates, suggesting additional factors like compensatory mechanisms, transcriptional regulation, and genomic plasticity influence resistance. Thoughtful. This complexity calls for genome-wide analyses to understand resistance evolution. The study highlights the urgent need for antifungal stewardship programs. Thoughtful routine. Susceptibility testing of C. auris isolates is crucial for guiding treatment. Optimizing antifungal dosing can enhance efficacy and reduce toxicity. Limiting unnecessary antifungal use is essential to prevent resistance. Serious multidisciplinary teams are vital for effective stewardship, especially in high-risk settings. The DAS et al. Study highlights the need for advanced Candida auris surveillance systems. Thoughtful retrospective collections are inadequate for full epidemiological understanding. Future surveillance should be prospective and population-based, integrating clinical, microbiological, and epidemiological data. Serious real-time data sharing is crucial due to Candida auris's global spread, necessitating coordinated international surveillance.
The study reveals significant gaps in understanding C. auris antifungal resistance. Known molecular pathways don't fully explain resistance, suggesting other biological processes are involved. Integrating functional genomics, transcriptomics, and experimental evolution is crucial. Genome-wide approaches are needed to explore efflux transporters, cell wall stress responses, and genomic plasticity, including aneuploidy and loss of heterozygosity. The DAS et al. Findings emphasize the urgency of infection prevention and control. Rising multi-drug resistance and nosocomial transmission of Candida auris necessitate systematic screening of high-risk patients, effective environmental decontamination with sporicidal agents, patient cohorting, and enhanced contact precautions to manage outbreaks effectively. C. auris has emerged independently across continents, as confirmed by Lockhart et al., suggesting convergent evolution. Chow et al. Highlighted dual mechanisms of spread: international importation and local transmission. Clade 1's evolutionary resistance in India is crucial for predicting global trends, especially amid rising echinocandin and amphotericin B resistance. Routine antifungal susceptibility testing for all Candida auris isolates is essential due to unpredictable resistance patterns. Infection prevention and control measures, such as active surveillance and environmental decontamination, are crucial. Clinicians should support robust surveillance systems to address gaps like referral bias and incomplete genotyping, ensuring effective management of Candida auris. Das et al. Highlight the growing multi-drug resistance of Candida auris, emphasizing the need for coordinated action. Key strategies include robust epidemiological data collection, comprehensive molecular analyses, and sustained stewardship and infection control investment. Without these, Candida auris will likely spread further, complicating treatment and impacting global health.